go the same zip rate as last time.
Alright, so right now I'm going to be hanging a mini bag for my patient. They've already had their IV inserted. The first thing I'm going to be doing is checking my doctor's orders. I'm going to make sure that this medication is appropriate for my patient, and because the order is for 100 milliliters of normal saline over 30 minutes, it is appropriate because my patient's dehydrated. So once that's been determined, I'm going to go ahead and get my medication together and my supplies together. So I've got a 10 milliliter syringe with 6 milliliters of normal saline, alcohol pads to clean the ports, my gloves, which I would get in the room, and then my 100 milliliter bag and my tubing. So I'm ready to go into the patient's room. So good morning, my name is Lyndsay. I'm a student nurse, and I'm going to be hanging your IV solution. This is to help with your dehydration. Can you tell me your name and date of birth, please? And I'm checking that it matches the wristband as well as my doctor's orders. I'm going to go ahead and wash my hands then, and I can put on my gloves. Alright, so my next step is going to be to assess the IV site. I'm going to making sure that there's no infiltration or inflammation. Don't see any signs of phlebitis. So I can then check the patency and flush the IV. I'm going to wipe the port with an alcohol swab, making sure it's clean. And then I can attach my syringe. And I'm going to push stop 3 milliliters of the saline. It's patent. After I've unclamped. Sorry. I'm going to unclamp the line, then push stop 3 milliliters of the saline. After that, I'm going to reclamp, unattach the saline, and then it's time to hang my bag and set that up. So I'm going to spike my bag first. So this one. Go ahead and spike my bag. Sure it's all the way on, and then I can hang. Alright, so I have my medication. It should be clamped.
I've already
Prime this for a second. Then going to unclamp and unclamp so that I can prime this tubing. Making sure that there's no air bubbles. Alright. No air bubbles, so I'm ready to attach to the client's IV line then, or INT tubing. Okay, I'm going to alcohol swab. Alcohol swab this again.
Okay. And we would have
and I would clean this. I already have the cap on it, and then I can attach. So once attached, I'm going to unclamp both the INT tubing and the primary line, and then I will be able to set my drop factor. Because it's 100 milliliters of normal saline in 30 minutes, the drop factor, in a drop factor of 10, I'm going to be giving 33 drops per minute. So looking at the clock, I'm going to adjust this.
This was a 50 milliliter bag, and
adjust this
to
33 drops.
This, we're going to say that this is also 10 drops per milliliter, and that coincidentally is the same rate of our IV, which was 17 drops per milliliter.
Alright, so now that that's set, I'm going to let this run for 30 minutes. Before I walk out of the room, I'm just going to educate the client on what to alert somebody with. If they feel any burning or they notice it's starting to get bigger, to call me. I can go ahead and undo or take off my gloves, and I'm going to go ahead and label my medication. I'm going to label my medication with the
I should
time,
have 17
date,
drops
the
per
patient's
minute
name,
through this
my
algorithm. If
drug,
it wasn't, I would want
dose,
to adjust
route,
the
and frequency.
I could also open this all the way and adjust my flow rate on this guy. But because this is
Place
fixed,
this
I'm gonna open this all the way.
in my med bag.
Verify that Dr.
Then going to label my tubing with my initials and the date and time.
Did not filter it in there. And there we go.
Alright,
That's
ask
what
the
I want
patient
to
if
do.
they have any questions. No questions. So I'm going to go ahead and wash my hands and get out of here. So then after 30 minutes, I'd come back and assess that the site still looks okay. My bag is empty, so first step is going to be clamping. Well, no, my first step would be identifying the patient once again, asking them their name and date of birth, looking at the wristband and the doctor's orders. It all matches up, so I'm going to go ahead and wash my hands.
How you doing?
I'm going to place my gloves on.
At this point, we're going to say that the bag has expired and that it is empty, so what we're going to do is I'm going to want to disconnect.
Now
So
I
what we'll
can
do
clamp off
is,
both the
here.
tubing, primary tubing,
Alright. I'm
and
going to
the
clamp off close,
INT tubing,
close,
and then I'll be able to disconnect.
cap this guy because we may want to use it in the future. There you go. Just hang you right there. There you go. I can leave.
So I would want to put an alligator clamp on here to keep this clean so that I can reuse it in the future.
This has already been
In case I get another dose.
from
And I'm
if
going
it
to
was
set
17, we
this
have to
aside.
adjust this to reflect 17.
After that, I'm going to want to flush.
Go back to the primary
So I'm
bag,
going
are still
to
17.
take my alcohol swab,
And that again was the 100 milliliters, or
Clean the end of this
1,000 milliliters,
again.
60 minutes by the drip rate factor of
attach,
10 drops per milliliter.
and I would once again push stop 3 milliliters.
We want to assess
after I've
patient
unclamped the
will,
INT.
Additionally,
Once I push stop the 3 milliliters, I'm going to reclamp. Taking note that I'm not doing heparin because this is a peripheral IV line and it was not ordered. After that, I can assess the site one more time. Didn't infiltrate while I was flushing. Go ahead and take my gloves off, wash my hands, and then I'm ready to document the date, time, the condition of the IV site, how the patient tolerated the medicine, and earlier I would have documented like the type of medicine, the frequency, the route, and the amount given as well in the INO chart.